Okay, welcome to this video. This is number 2 video when it comes to root canals for the staff at Cross Timbers Dental. This is going to be on setting up a root canal. First of all, we have a root canal cart, and in that cart we have all of our supplies and all the stuff that's in there. But on top of the root canal cart, you'll see this big placemat. And if you can find all the different items and put them on this placemat, then you will be completely set up and ready to go for the procedure. So that's just a little helpful hint. But let's go through some of the other things. In the drawer in the endo cart is a green tub, and it says ready to go endo. So if you take the lid off of it, you'll find all of the stuff that we're going to need during the course of the procedure. We have an endo block here. We've got the files put together here. We also have a drop-off sponge here. I'll explain that in a second. A little micro suction. We have a syringe with a syringe tip, a smaller syringe with a syringe tip. This is a endo activator tip, and this is a root apex locator hook that we use. Let's talk about setting up this standardized set right here. If you'll notice, a vast majority of our root canals we do are going to have different lengths, which in that other video we talked about file lengths, and I would say almost 95% of the time, we will be using the 21 millimeter length rotary files. So again, these are the rotary files here, and we're going to use the 21 millimeter length. So that is these guys right here. But when it comes to this hand file, this purple one, number 10, we want that one to be 25 millimeters in length. And so that one is, that one's right here. So that's how we want this standardized set of files put together. If we need something different, of course, we'll just make that determination there chairside, and we'll put together a different setup of files. But like I said, this is a vast majority of the time. These are going to be the files that we're going to use for our root canals. Now, I mentioned earlier about we have a regular sponge here, and then we have another sponge. I call this the drop-off sponge, or we could call it the dirty sponge if you want to think of it that way. These files, we use them one time or for one patient, and then we're done with it. We throw them away. Now, each one of these files costs about $20. So we're not afraid to use whatever it takes to get the job done, but we certainly don't want to waste or throw away files that were unused. But if we were to say, take out this file right here, use it in the patient's mouth and put it back into this sponge, then this sponge is contaminated. And we don't want to mix a clean file with a contaminated file. So when we take a file out of this supply sponge and use it in the patient's mouth, when we are done taking out the patient's mouth and taking it out of the handpiece, and we're going to put it back somewhere. We're going to put it back in this dirty or drop-off sponge. We're going to drop off the file here. Now, we may go back to it later, but we know this is going to be the one that's going to have the patient's germs on it, whereas this is still a clean sponge. We may go through the entire process and maybe use just these 4 files here and perhaps this hand file, and we'll leave these 2 behind. If they were never contaminated, and of course, and not used in the patient's mouth, then we can put those back in the cart and we can have those ready for next time. So again, we don't want to waste anything, but we're going to use whatever it takes to get the job done. Let's just not be wasteful about it. Now, when it comes to hand pieces, we have different hand pieces that fit into the actual handpiece holders. And we have a couple different types here in our office. We have 2 that look very similar to one another. If you roll them over to their sides, you'll see that we have a sticker. This one says a 16:1, and that says a 10:1. If you look in the cart, you'll find the little heads that stick on these hand pieces, and they're clearly marked 10:1, 16:1. Make sure they're matched to the correct one. This one, now that I put together this presentation, I should realize I should make this more clear, but this one is a 16:1. So make sure that the 16:1 goes on that one. And I can tell you that most doctors will prefer this one. This is the electronic one that has a readout right here on the front. We've kind of preferred this one. But these guys are available if we need them, if this one is not available. But this kind of is our default. And they're stored back in sterile 2. Again, here they are. Here's the one that I think most of us docs would prefer. But we can work with the ones on the side as well. Okay, let's go on to those syringes that were inside that tub. These syringes is what we're going to use to put in our different irrigating solutions. We've got kind of a bigger one here, a fatter one, then we have a more skinny one. For the fatter one, we're going to use, oops, I got that in the wrong order. For the fatter one, we're going to use sodium hypochlorite also known as bleach. When we put this on here, what we're going to do is we're going to backfill this solution into this syringe and then put the top on it. Now, of course, this is bleach. We want to make sure this doesn't drip on anyone's clothes or on any of the upholstery in the operatory, because, of course, it will bleach the material. So we want to make sure we're careful with this. Here's an example I put in. I just realized someone had filled one of these up ahead of time. We don't want to pre-fill and have it just sit in the cart. We'd much rather have it just filled at the time the patient is in the chair. So it's, it's fresh inside the syringe. And this is actually filled too much. We don't need that much volume of material. Probably half that amount will be fine. So again, with the sodium hypochlorite, that's about as much as we're going to want. Okay. Now, later on in the procedure, we're going to use a thing called a canal cleaner. It's made by the Endo Sequence, which is the same people who make the files. And that's that smaller syringe. And again, it's going to backfill into maybe about halfway full. And that should be enough for what we need for the procedure. Next, we're going to have set up is the Root ZX, which is also the Apex locator. This is an electronic measuring device as us doctors are trying to find how long a canal is. We kind of put the files down inside the canal until it reaches the root tip. And this device lets us know that by a visual display on this monitor, but also has an auditory beeping sound that lets us know. What you need to know is when you're getting this set up is that little hook, if you remember, if we go up to here, inside this tub was that little hook right there. That hook goes into this thing right there, because this part is going to actually just hook onto the patient's lip. So obviously we have to sterilize it at the end of the procedure. And then lastly, to get set up is this piece of equipment. This is our touch and go heat. What this does is at the very end of the procedure, when we got our percha points in, those little orange rubbery things, we need to kind of singe these things off or cut them off at the base of the pulp chamber. And so this is an electronic way of heating up this little tiny metal tip so we can singe it off. Back in the olden days, we actually had to get a flame and get a metal probe or an explorer and actually heat it up like a red hot poker and then go into the mouth and hopefully not burn anybody in the process. This is a much safer way of doing it. This is only going to get hot when these coils right here with our finger, we can pull those little coils down to kind of activate the electricity going through this tip. That's the only time that this will get hot. So when this is on, this will start to make a beeping sound to alert everybody that electricity is going through this. You're not going to get electrocuted, but you could burn yourself if you got this thing beeping and you touch the tip of it. So let's not touch the tip of it. But it just gives us a way to go into the patient's mouth, get to the target area, activate the heat, the electricity, and singe off what we need and come back out. So it's a much safer way of doing it. Now this tip, if you were to take this part right here and kind of unscrew it off, you could take that little tip out, because you can see over time these things can get bent, and there's a little insert that we could replace and put a new one in. But that's it when it comes to putting together what we need for a root canal. Also know that when we begin the procedure, we're going to routinely get a CT scan of the patient as well as a PA before we actually begin the procedure. All right, that's it for this video. We got one more to go, and that will kind of round out our root canal series. All right, take care. Thanks.